Hey guys, this is Dr. Hub. Today we're going to look at the classification. So it's going to be the classification and as well as the theory of cholesteatoma. So what happens here? So first to begin with, there is a congenital cholesteatoma. So there is congenital cholesteatoma. So the congenital cholesteatoma, it is which has a nidus of trapped squamous epithelium present at birth. So this is that which has a nidus which is trapped squamous epithelium. So it is a nidus of trapped squamous epithelium, is a nidus of trapped squamous epithelium, and it is present at the birth. Next is the primary acquired. There is primary acquired. So in terms of primary acquired, it is the cholesteatoma is associated with a defect in the pars flaccida. So primary means it has a defect in the pars flaccida. So pars flaccida, we can call it a defect here. Then we move on to the secondary acquired. So what is exactly happening in the secondary acquired? It is a cholesteatoma is associated with a defect in the pars tensa. So secondary means it is pars tensa, defect in the pars tensa. Then we move on to what happens in the tertiary. So in terms of tertiary acquired cholesteatoma, it is defined at which that occurs behind a normal appearing tympanic membrane. So it is behind the normal appearing tympanic membrane, and as a result of implantation of the antecedent middle ear. So this is due to the implantation. So it is due to the implantation of the antecedent middle ear inflammation. Antecedent middle ear inflammation. So it is a defect of the antecedent middle ear inflammation. So it is the implantation. It was the implantation of the antecedent middle ear inflammation. Next is we are going to look at the theories. So what is happening in case of theories? This is also very important to know. So under theories, there is a congenital cholesteatoma. There is something known as a congenital cholesteatoma. So in terms of congenital cholesteatoma, the theory is there is a congenital cell rest. So the theory here is the congenital cell rest. So here what happens is the presence of the congenital epithelial cell, it rests. So the cells of presence of congenital epithelial cells, they rest. So it rests within the middle ear cleft of the tympanum bone. This will be within the middle ear cleft. So this will be within the middle ear cleft or the temporal bone. Next is we will be looking at the Wittmaack. So it is Wittmaack's. So this is going to be the Wittmaack's, and it is the theory of the retraction pockets. So it is nothing but the theory of the retraction pockets. So to continue this is nothing but a negative middle ear pressure. So there is a negative middle ear mid-ear pressure. So there is a negative mid-ear pressure, and this leads to the formation of the retraction pockets. So the negative mid-ear pressure amounts to the retraction pockets. So it forms the retraction pockets, and this is usually in the posterior superior parts of the pars tensa. So this is located in the posterior superior part of the pars tensa, and as well as the pars flaccida, So this accumulates keratin debris. So this which accumulates. So the negative middle ear pressure leads to the formation of the retraction pockets, which accumulates the keratin debris. So it accumulates the keratin debris. So this Whitmark's theory, it is coming under a primary acquired cholesteatoma. So it was under the primary acquired. So first one we saw was the Whitmark. Next is we are going to look at the Rudis. It is a Rudis. So what's happening in the Rudis? So this is going to be the Rudis theory of the basal cell hyperplasia. So it is Rudis theory of the basal cell. So it is a basal cell hyperplasia. So in terms of the Rudis theory of basal cell hyperplasia, the basal cell layer of the germinal layer of the skin. So there is a basal cell layer, and this is of the germinal layer of skin. So what happens is this proliferates, and in response to the infection, it proliferates in response to the infection as well as other stimuli. Next is we move on to the Sadie's metaplasia theory. The Sadie's metaplasia theory. So under this there is a repeated infection. So there is a repeated So we can see there is a repeated infection, and this is of the otitis media. It is of the otitis media with effusion, and it leads to the metaplasia. So what it does is it leads to the metaplasia, and this is nothing but of the middle ear, metaplasia of the middle ear epithelium. So it leads to the metaplasia of the middle ear epithelium, and this is into the squamous type. Next is we move on to the secondary acquired cholesteatoma. The secondary acquired cholesteatoma. So in terms of the secondary acquired cholesteatoma, it includes the Haberman theory of epithelial invasion. So there is a Haberman theory of the epithelial invasion. So what's happening here? There is a marginal perforation. So there is a marginal perforation which is taking place, and this leads to nothing but ingrowth. It leads to the ingrowth of squamous epithelium, and this will be of the meatus, or the outer surface, and this will be of the tympanic membrane, outer surface of the tympanic membrane into that of the middle ear. So let's just recap. It is nothing but a marginal perforation. Which leads to an ingrowth of the squamous epithelium of the meatus or the outer surface of the tympanic membrane into that of the mid-ear. Next, we move on to the Sadie's metaplasia theory. So we already saw, let's recap. So in terms of the Sadie's metaplasia theory, this is with respect to the secondary acquired cholesteatoma. Sadie metaplasia theory. So under this, there is a repeated infections. There is repeated infection, and this repeated infection is nothing but it includes the ASOM as well as the CSOM. So this leads to the metaplasia of the middle ear. So it leads to the metaplasia, and this is going to be of the middle ear, mid-ear, and mid-ear epithelium, and into the squamous type, So the metaplasia of the middle ear epithelium into the squamous type. So this was all about the classification as well as the origin of the theories, the theory of origin of the cholesteatoma. To learn and grow daily like this, please do subscribe.